Let me ask you something. Do you know where your pec minor is? How about serratus anterior or flexor carpi radialis? What's the action of supinator? Well, actually that's pretty obvious. But let's get one thing straight. What's the deal with subclavius? And what muscle gives you spirit fingers? Let's face it, you need an anatomy review. Better call Alex and Jonathan. So, we are going to start with pec major. Pec major comes from the sternum and the costal cartilage of the ribs right next to the sternum, all the way down to the lower end of the costal cartilages, ribs 6, 7, kind of joined together in this spot. And then we have the medial half of the clavicle right over there. The insertion is going to be over here, and this could be a tricky one to find. We can follow the muscle belly coming down through here. You can see the slight edge right there of where deltoid joins in with pec. The bottom edge of the pec is right there. Go ahead and lift your arm forward for me. There we go, and you can see the muscle contracting right through here. Let it go. Remember, a deltoid covers this over a little bit, so it's hard to feel the exact insertion point. But it is the lateral lip of the intertubercular groove. And we can find the biceps tendon by flipping over it. So that tells us where the groove is, and this muscle is just on the lateral edge of it, right about there. There's an interesting feature where the muscle, the top fibers actually go to the bottom, and the bottom fibers actually go to the top. So there's a twist in the muscle belly as it does that, and what that allows us is it will actually untwist itself as we bring our arm up, which gives us more range. The actions of pec major are going to be adduction, internal rotation for all the fibers. Same thing, horizontal flexion for all the fibers. The lowest fibers here can assist extension. And when we say extension, in this case, it doesn't mean extension from neutral, it means extension from flexion. So if your arm is up here, which the upper fibers can help us bring it up here into flexion, these lower fibers will help pull down into extension. Because the pec major fibers cross the scapula joint onto the humerus, it can also move the scapula. So the pec can also depress the scapula. It can protract or abduct the scapula. So when we look at all these fibers coming together, that's about as short as we're going to get pec. And then if we're going to be stretching pec, lengthening those fibers is going to be bringing this as far away from here as possible. This is your standard like doorway stretch muscle. So now we're going to move on from pec onto the deltoid. And the deltoid we're going to have to do in two pieces because it has anterior, middle, and posterior divisions. The middle will kind of get caught with a little bit of the both of the anterior and posterior divisions. So we're going to look at the anterior division first of all, which is right next to pec major. And we can see the front edge of it right following this edge. There's a little bit of a gap in between the pec and the anterior deltoid right here. So we're talking lateral third or so of the anterior clavicle. We can kind of feel that coming to a point right there. So there is the acromion, which is the next attachment. It also attaches along the spine of the scapula. We'll draw that later. The insertion is down here on the deltoid tuberosity of the humerus. Pretty easy to see because you can, or pretty easy to find because you can follow the deltoid down to its attachment right about there. So filling in the anterior deltoid fibers, like so. That's a little bit of the middle deltoid too. So because deltoid has so much of a spread, it's a convergent muscle, you always get a lot of actions with convergent muscles. So basically, you know, the front end of it is it's the antagonist of the back end of it. But when we look at all the fibers together, bringing this as close as we can to the origins, we have abduction. The anterior fibers are also going to horizontally flex, flex, and internally rotate as that moves in. And we'll look at the back half when we get to the back. So now we're going to take one step deeper from the pec major and the anterior deltoid and finish out the rest of the arm. The first muscle we're going to deal with is the pectoralis minor, which we can't really see in this position because it's underneath the pec major. So we're going to have to find those bony landmarks through other muscles. Normally we start with the origin, but in this case, we're going to start with the coracoid process, which is the insertion. Just verifying that I've got that. There's our coracoid process. And the origin is ribs 2, 3, 4, and 5. The second rib may vary a little bit from person to person. As we're finding ribs, the first rib you feel right under the clavicle is rib 1. The first gap you find is between 1 and 2. So you can find 2, and that's going to course like so. 3, 4, and 5. And generally, those attachments are going to be right near the costal cartilage. So we'll put the pec minor right there. Now the pec minor is going to be a muscle that attaches to the scapula and the torso, which means that it's moving the shoulder girdle, not the humerus. So when we talk about these actions, we're dealing with protraction, which is also abduction, and depression, which will bring this closer to here. If the arm is up, and meaning the scapula is also upwardly rotated, the pec minor will help downwardly rotate the scapula. With the origin insertion reversed, if the shoulder is fixed in place through other muscle contractions, the pec minor will help pull the ribs up to meet it, which looks like taking a deep breath in. So there we go. And you can actually kind of see both the pecs fire to help that happen. The pec minor is one of the biggest muscles implicated when we look at postural anterior tilt of the scapula. We have a small but important muscle called the SUBCLAVIUS. It attaches at rib 1. I'm going to draw this as best I can, but mostly it's hidden behind the clavicle. So it attaches at rib 1, deep right about here, because rib 1, while it's exposed right here, it goes mostly under the clavicle and around to come back over to the side here. But where it attaches is right there. It inserts on the inferior surface of the middle clavicle, basically right there. So it basically hides underneath the clavicle. It will help depress the clavicle and elevate the first rib up to the clavicle, as well as just hold the clavicle into the rib cage, which is the problem that we see in body work a lot, is that when subclavius contracts too much or doesn't release, it basically locks the shoulder girdle down here into the rib cage. So getting underneath and to open up that muscle helps to lift the entire shoulder up and away off of the rib cage. Now we're going to take a trip down the arm and look at the coracobrachialis. For that, I'm going to have you bring your arm and lay it out to the side. So the coracobrachialis hides sort of right underneath the side of the biceps brachii right here, which we're going to deal with next. So the coracobrachialis arises right next to the pec minor from the coracoid process, and it inserts about the middle medial third of the humerus, which I'm not going to dig too deep because there's blood vessels and nerves right near, and that's kind of the warning with coracobrachialis, is we do have to work carefully around it to be able to access it without getting at the neurovascular bundle that runs through there. So this is going to go, remember, this is all deep to what I've drawn earlier. This muscle goes down right through there. The coracobrachialis will flex and adduct. Next up is the biceps brachii, and that is going to have two heads. I'm going to start with a short head. It starts from the coracoid process, and it travels down through here. Most of the split in it is hidden by the deltoid and the pec. The long head comes from the supraglenoid tubercle, which is actually deep in the shoulder, just above the shoulder joint right there. We can feel the tendon right about there. It's going to course over the top of the shoulder, down the intertubercular groove of the humerus, and join into the muscle belly, which is right there. And you can hold your arm like that for me, please. And you can see the muscle coming down, down to a point. Hold your arm like that. Just keep holding it. That's perfect. There's its tendon, which is going to insert on the radial tuberosity right there. It does have an aponeurotic, or an aponeurosis, which follows the fibers down and swings off to the side over here toward the coronoid process and the ulna. The biceps brachii is going to, since it attaches to the radius, it's going to flex the elbow. Because of the way it wraps when we pronate, because of the way the tendon wraps under the radius, it will actually help us supinate the forearm. And because it attaches to the shoulder, it will help flex the shoulder. Okay, next up we have trapezius. And trapezius is one of the largest muscles on the back. Fairly easy to see the outline of it. It's going to start from the external occipital protuberance, which is right there in the base of the occiput. It's going to attach all the way down the nuchal ligament to C7, and then from the spinous processes of C7 down to T12, which is about right there. I mean, I can actually see the line of it, which has taken me down to it. It inserts along, I realize you cannot see this from the camera, but when we flip this all over and complete this, you'll be able to see all of it. It inserts in the same exact location that the deltoid arises from, the lateral third of the clavicle, the acromion, and the spine of the scapula. So the upper fibers are going to come down and course through this area, right to there, and it keeps going out like so. Ultimately, those lowest fibers are right there. So the upper fibers will elevate, and then they're going to act on the head as well. So in this case, if we have one side contracting, we'll get lateral flexion. Just show that for me. Perfect. And it will get contralateral rotation. That is turning the head toward the opposing side. You can see how those get closer together. Bring it back to the center. If you have them acting bilaterally, you will get extension of the head and neck. Perfect. Thank you. The middle fibers of the trapezius will adduct or retract the scapula. The lower fibers will depress the scapula. When acting alone, will create elevation or depression. However, if they act together, it will actually swing the shoulder girdle into an upward rotation. Okay, next up is levator scapulae, and that is going to arise from the transverse processes of C1, which is just below the mastoid right here, to C4, basically right in a line like so. Look for the most lateral area of bone that you feel at the side of the neck, and that's going to be the transverse processes. And the insertion is going to be the medial border just above the spine and up onto the superior angle of the scapula. So that stays pretty close to the neck as it courses down through here. The way I'm drawing it, because I have to draw on the skin, which is much wider than the bone structure, makes this look like it's way further out than it actually is. In reality, the trap and the levator are actually pretty close together in the side of the neck. The levator scapulae, as you might expect, will elevate the scapula. It also will assist if the scapula is upwardly rotated. It will help pull the superior angle up to the neck and assist with downward rotation of the scapula. And since it attaches to the neck, if the scapula is fixed in place by other musculature, you will get, just like trapezius, lateral flexion of the neck over to the same side. In levator scapulae's case, you're going to get ipsilateral rotation as it turns the side of the neck. You can see those 2 points coming closer together. Back to the center, and then both sides working in conjunction will produce extension of the neck. The levator scapulae has a really common trigger point right here above its insertion point, which draws most of us manual therapists to this area to try to work it out, but do be careful of attacking the superior angle of the scapula, which can be pretty sharp. So see if you can find that angle and then work directly off of it. Just below levator, we have the two rhomboids, minor and major. The rhomboid minor is going to rise from the spinous processes of C7 and T1 right through there and insert on the medial border of the scapula right at the level of the spine of the scapula, so right across there. The rhomboid major just below it, but about twice the height of it. You can kind of feel the edge of the you know, like there's a distinct angle of the bottom of the scapula right here, and the medial border becomes a little less defined right around there. That's because you have rhomboid there now. Because the origin is going to be from the the spinous processes of T2 through T5. And the insertion is going to be the medial border of the scapula from the spine, not quite to the inferior angle, but pretty close. Functionally, they act together to adduct and or retract the scapula. They will also assist with downward rotation of the scapula if the scapula is upwardly rotated to get started. Okay, now we're going to look at two muscles that start on the back but actually finish their way under the armpit in the front. The first one is latissimus dorsi, and its origin is going to be the posterior iliac crest right through here, the sacrum, and the transverse processes of T6 or 7 down to the sacrum, down to L5, and the thoracolumbar aponeurosis, which wraps over like everything basically in this area, all the erectors and all that. And we can kind of see, in some people you can see, I probably drew that a little too high. The lat is coming around like so. So I'm guessing in your case you probably have it coming from T7 maybe instead of T6. And you can see the lat off to the side right here. It's fairly thin and flat through this area. In fact, it's mostly tendon through this area. It's about here that it becomes muscular. And you can start actually, the fibers start to converge, and then the muscle has a bit of thickness to it. Teres major arises kind of right next door from the inferior third of the lateral border, right near the inferior angle. Right like so. You can feel the two. Let's do this. Let me have you push down against my leg, and you can see those two muscles pop out. So there is teres major, and almost there. Lats dorsi, coursing up through here, and you can relax that. So the drawing here makes it look like it's going to the back, but in fact, it's going to the front. So at this point, let me have you roll to your side. The insertion for both of these is the intertubercular groove of the humerus, which seems kind of ridiculous based upon where they came from, but this is actually a lot closer to the back than you might think when you look at the skeletal structure. So we find our pec major, which is attaching basically right about there. The skin has moved a little bit from the sideline to from the face up to the sideline where I originally drew it, so it's a little bit off in its position, but it's good enough for what we're looking for here. So hold your arm right there for me, but push it down toward me just a little bit. Perfect. And there they are. There's lat, telling you exactly where it's going. Up through the armpit, through the posterior wall of the armpit. Teres major, now that we're on their side, push down again. Looks just a little bit different. Coursing in this direction. And they're both, it's hard to draw them completely through the armpit. This was something that I had to go to a cadaver lab to really appreciate how they attached, where they attached. But teres major is going to insert on the the medial lip of the intertubercular groove. And the lats is going to attach right down the center of the intertubercular groove. lats and the teres share the same actions. They're both going to adduct, extend, and internally rotate the humerus. Because they cross from the body to the humerus, they're both going to work through the scapula in producing depression of the scapula. All right, back to face down again so we can look at the posterior rotator cuff. The upper muscle of this is going to be the supraspinatus, which comes from the supraspinous fossa, which is just above the spine of the scapula right there, hidden by trapezius, so it's hard to feel the actual muscle belly itself. It goes under the acromion to get to the superior part of the greater tubercle, which is right about there. So I'll draw a dotted line to indicate that it's underneath the acromion. Besides its job as part of the rotator cuff in stabilizing the humerus to the scapula, this muscle functionally is going to abduct the humerus. The infraspinatus is just below this, and it is going to arise from the infraspinous fossa, which takes up most of the back of the scapula. And it goes out this direction to insert free of the acromion onto the posterior surface of the greater tubercle just below supraspinatus. And it is functionally paired with the teres minor, which is just below it. So we can feel on the medial border, the lateral border of the scapula, we can feel a little bit of a flip of a muscle right off the edge of it. That is teres minor. Sometimes teres minor and infraspinatus are actually the same muscle. Functionally speaking, they're the same. Besides stabilizing the humerus to the scapula is to externally rotate the humerus. They will also help horizontally extend. You can see them coming together there. And they will also assist with extension of the humerus. Now that we have these drawn, let's put the muscle that drapes over the top of this on. That is the posterior deltoid. And so we left it at the acromion processes of the scapula. So the rest of its attachment is the same thing as the insertion of trapezius, which is the spine of the scapula, right out to there. And the insertion, same as before, deltoid tuberosity of the humerus. You can kind of see the bulk of this muscle coming down and covering over everything underneath it. The posterior deltoid is the functional opposite of the anterior deltoid, except for abduction, which all fibers perform abduction of the humerus. In this case, the posterior fibers will externally rotate, horizontally extend, and extend the humerus. So this is the lateral head of the triceps brachii. It arises from the upper posterior portion of the humerus. And let's move over to the long head, which arises from the infraglenoid tubercle right there. And go ahead and give me some extension, and you can see the long head sticking out like so. And then relax. Underneath all of this, why we can't feel the humerus as distinctly in this lower area is because of the medial head, which arises from the lower sort of 2/3 of the humerus. And the muscle belly is going to kind of stick out like so, wrapping around. Tendon is going through here, ultimately inserting on the olecranon process. Note that there is a slight gap in between the lateral head and the medial head's origins, where the radial nerve comes out and goes around. The triceps brachii, all heads will extend the elbow. The long head will also extend the humerus and may assist with adduction of the humerus. To finish off the rotator cuff, which remember it's supraspinatus, infraspinatus, and teres minor, drawing on the body makes everything look bigger than it actually is, but the subscapularis is actually right on the other side of the scapula from those three. The subscapularis arises from the subscapular fossa, which is right here. I'm only going to dig so much for an anatomy demo here. So subscapularis arises from the subscapularis fossa, which is way bigger than this image makes it look. and it inserts on, bring that down, the lesser tubercle of the humerus, which is just next to the coracoid process, right about there. The subscapularis, in addition to acting as a rotator cuff muscle and stabilizing the humerus to the scapula, the subscapularis, let me have you bend your elbow, will primarily internally rotate the humerus. Now, one last shoulder muscle, but definitely not the least, the serratus anterior. This is a fairly large muscle, larger than most people think of. Usually we see just the little fleshy digitations of it sticking out right about here in the lower rib cage area, but that's just the very bottom third of it or so. It arises from ribs 1, the lateral surfaces of ribs 1 through 8 or 9, so all the way down here. And as it does so, it creates a serrated kind of sawtooth edge. I can't draw the rest of it because it is deep up here. Realize that rib 1, where it attaches, is actually right up in here. So if you're working on the rib 1 right near the scalene attachment, you're actually working really, really close to the upper serratus attachment too. The fibers, of course, like so. Underneath all of this, I'm just going to do a little bit of dotted lines to indicate how far it goes underneath the lats and everything else. Ultimately, bring that arm down, it's going to attach, and let me have you roll forward just a touch. It attaches at the medial border of the scapula, on the undersurface of it. So because this muscle courses underneath to attach here, anything that's going to bring the scapula forward is going to be what the serratus helps with. So we're looking at protraction or abduction of the scapula, as well as the lower fibers can help with upward rotation of the scapula as it pulls these lower fibers, the lowest part of the scapula, out this way. It raises the whole thing up. It will also, if the scapula is fixed, help with bringing the ribs up to the scapula. So take a deep breath in for me. Serratus is so helpful for breath work. Because of how the serratus anterior pulls the scapula onto the rib cage, if the serratus anterior is weak, it will cause a winged scapula, where the scapula pulls away from the rib cage. So just envision this muscle grabbing here and pulling underneath to pull the scapula into the rib cage. Now that we're here in the side leg position, you can see the entirety of the deltoid coming from the clavicle, the acromion, the spine of the scapula, and converging onto the deltoid tuberosity of the humerus. The brachialis arises from the distal 2/3 of the anterior humerus, right along this area. It's underneath the biceps. It kind of makes high heels for the biceps. It makes the bicep look a little thicker and a little bit more proud than it actually is. So we can feel the edge of the brachialis right here. It basically arises right from like the deltoid tuberosity on down. So we can see the side of the brachialis right there, and then dotted lines to indicate that it's underneath the biceps right through here. And it's a little thicker over on this side as well, but we have to be careful with palpation because we do have the brachial blood vessels and nerve going right through this area. It inserts on the coronoid process of the ulna, which is this landmark right here. Notice that it has a curved sort of crown-like shape. That can be tricky to find on an actual body, so bend the elbow a little bit and you can start to feel the difference between which bone is moving in which way, and there's a spot here that doesn't really move that much. That's the coronoid process. Brachialis has one function. Because it attaches to the ulna cannot pronate or supinate. It can only flex or extend. So since it's on the front, we are looking at flexion of the forearm. The pronator teres is a cylindrically shaped muscle that covers over a part of the median nerve as it runs through this area. So it's a very important muscle to work and to understand and to be careful with. It arises from the medial epicondyle, the common flexor tendon, which is right there, and the coronoid process, which is right next to it. So there's our origin. It inserts about here on the radius. Keep in mind I'm drawing this on top of, you can kind of feel, there's a hollow right here, and as you follow that hollow, you'll run right up against something. That's the pronator teres. Primarily, the pronator teres is going to pronate the forearm because it attaches to the radius. It's going to rotate the radius over. But because of its location across here, it will weakly flex the elbow. So, next up is the flexor carpi radialis, which arises from the common flexor tendon at the medial epicondyle, right next to pronator teres. There's a bunch of stuff jammed into that small space. Its muscle belly is found right next to the pronator teres, right across here. You can easily feel its tendon. If you move your hands like that, you can usually see two tendons popping out right there. Yours is pretty easy to feel. It's right next to the radial pulse right there. Okay, and this one, the tendon goes through here to insert at the base of the second and third metacarpals. Feeling it through the palm can be a little tricky. It actually inserts right there. So since we can't feel the front, what I like to do is to flip the hand around so that you can feel the back of where those metatarsals come to their base, and then just triangulate that over to the front right there. This muscle goes through the carpal tunnel to get to its insertion. It is going to flex the wrist, radially deviate or abduct the wrist, and because it attaches up here, it will weakly flex the elbow. Our next muscle is missing in a significant portion of the population. It is called the palmaris longus. You can see if you have it or not by doing motions like this that pop the tendons out. You can see that I do have a flexor carpi radialis and a palmaris longus. Note that the palmaris longus sticks out a little bit further than the flexor carpi radialis, because it's the only muscle that goes over the carpal tunnel. It arises from the common flexor tendon at the medial epicondyle right there. It's right next to the flexor carpi radialis. And let's see, I don't think you have a palmaris longus. It would be right through here. And it attaches on the palmar aponeurosis, basically all across here. There's a little bit of attachment onto the flexor retinaculum as well. It will cup the palm, flex the wrist, and weakly flex the elbow. Flexor carpi ulnaris is a two-headed muscle. One head comes from the common flexor tendon at the medial epicondyle, and the other head comes from down here on the proximal posterior ulna. I'm going to flex the elbow all the way so that's easier to see. Again, this stuff all looks bigger than it actually is in real life, but the flexor carpi radialis is actually a fairly substantial wrist flexor here. Comes down like that. Inserts onto the pisiform and the hook of the hamate right next to it. Also going through the carpal tunnel to get there. This muscle will ulnarly deviate or adduct, flex the wrist, and this has the weakest leverage, I think, to be able to make flexion of the elbow happen. On the posterior forearm, we will start with ANCONEUS, which is a little bit, you can see this kind of hollowed out area right in there. Forms a bit of an A shape like that. That is ANCONEUS, coming from the lateral epicondyle of the humerus and inserting on the proximal posterior ulna. And it will very weakly extend the elbow. Next up, we have extensor carpi radialis longus and brevis. Extensor carpi radialis longus arises from the lateral supracondylar ridge of the humerus, right there. And the brevis attaches right here on the lateral epicondyle. They both course down together. You You can kind of feel their tendon right across this area. They're going to insert just like their cousin on the front side on the base of metacarpals 2 and 3. In this case, the longest goes to 2, and the brevis goes to 3. And both these muscles are going to extend the wrist as well as radially deviate or abduct the wrist. And because they go above the elbow joint, they're also going to assist with flexion of the elbow. Next up, we have extensor digitorum, otherwise known as the spirit fingers muscle. The origin is the lateral epicondyle right here, and the insertion is going to be this extensor mechanism. Well, essentially, we're going to attach at the base of the middle and distal phalanges, digits 2 through 5. So the muscle bellies through here, and if you kind of flutter your fingers around a little bit, you can see those muscles. We can see where that muscle is moving, and you can relax. So it goes through here, splitting and weaving back and forth a few different times. Before it gets to its ultimate insertions. This muscle is going to extend all the phalanges of the fingers as well as the wrist. Extensor carpi ulnaris will finish out the superficial arm muscles here. We have the origin at the lateral epicondyle of the humerus, and the insertion is down here at the base of metacarpal number 5. And there's a second origin that is also along here, the posterior proximal ulna, similar to the flexor carpi ulnaris, but going different directions. Extensor carpi ulnaris will extend the wrist and ulnarly deviate or adduct the wrist. To finish off the superficial layer of muscles in the forearm, we got to put in the brachioradialis, which arises from the lateral supracondylar ridge just above the extensor carpi radialises. And this muscle inserts under the styloid process of the radius. And if you could flex for me, you can see it's a muscle that's kind of hidden away until you ask it to do some work, and then it pops right out. And let it go. So muscle belly is right there. It's a fairly strong flexor of the elbow. Because it's positioned, it wants to basically bring the thumb straight up, or I should say the thumb side of the wrist straight up to the arm. So it will also help with pronating from a supinated position and supinating from a pronated position, basically to this neutral. Filling in this gap, what looks like a gap, is just the difference between where the skin was when I drew this on the back versus when I drew it on the front, but all of this is filled in with the extensor carpi radialis. Okay, flexor digitorum superficialis, which has a lot of different origins. We are the common flexor tendon at the medial epicondyle, right in through here. And then it also has an attachment across the ulnar collateral ligament and the coronoid process, and the proximal shaft of the ulna, and the proximal anterior shaft of the radius right through here. So there's a bit of a gap. The muscle belly fills in most of this space. Remember, this is underneath all the muscles that I previously drew. Muscle belly comes through here. You can kind of see the tendons underneath the superficial ones in this little gap right there, especially if you move your fingers. And as it goes through here, the flexor digitorum superficialis has an interesting sort of tunnel shape to the tendon, where the tendon, the single tendon, comes down and it splits to insert on the sides of the bases of the middle phalanges of digits 2 through 5. The flexor digitorum superficialis will flex the middle and proximal phalanges, making this shape, like so, and it will also flex the wrist. Just underneath the flexor digitorum superficialis is the flexor digitorum profundus. which attaches all along the proximal anterior medial shaft of the ulna, basically just underneath and beyond the flexor digitorum superficialis. Just like the superficialis, it has 4 tendons which go down, and in this case, they go through the tunnel of the superficialis to insert on the distal phalanges of digits 2 through 5. Just like the superficialis, the profundus will flex all the phalanges of digits 2 through 5, as well as flex the wrist. The flexor pollicis longus arises from the anterior surface of the radius all along here and the adjoining interosseous membrane. So right like that. And if you flex your thumb a few times, you can usually see that muscle firing underneath there to give you an indication of where it is. Perfect, thanks, let it go. And this one goes through the carpal tunnel, angles around to insert at the base of the distal phalanx of digit 1. So it's going to flex both phalanges of the thumb as well as flexing the wrist. At the distal end of the wrist, we have a small thin muscle called the pronator quadratus, quadratus meaning 4-sided. It arises from the anterior distal ulna and inserts on the anterior distal radius. And I'm actually going to sneak that muscle underneath all these other ones because it does sit deep to all of the other muscles. Pulling the radius over to the ulna, right where this muscle attaches, will create pronation of the forearm. The supinator rises from the lateral epicondyle, the annular and lateral collateral ligaments, which are right next door to that, as well as the supinator crest of the ulna, right in through there. These are landmarks that are a little hard to find, especially the supinator crest, so I brought in this visual aid. So you can see where this attaches. That right there is the supinator crest of the ulna. So this muscle is tucked pretty deep underneath all of that. The red mark is its origin. The blue mark right here is its insertion on the proximal posterior lateral radius, right up through there. And the way that I have always kind of remembered this muscle is to think that there's 4 separate origins. So you can track one origin with each finger, and that gives you the basic shape and orientation of the supinator. Again, drawing it on the outside of the body makes it look much bigger than it actually is, but you can see from the skeleton model how moving it in the same position, how bringing the insertion and the origin closer together is supination. And you can see how when we pronate, how far apart we end up pulling those two. The abductor pollicis longus arises from the posterior radius, ulna, and the interosseous membrane. It's a bigger muscle than we think. And it follows down to insert at the base of metacarpal number 1, right there. And this muscle's tendon creates part of the anatomical snuff box. It's actually right there. It wraps over and around into this spot. And this one is going to abduct and extend the thumb, pulling it back in that direction. It will also assist radial deviation of the wrist. The extensor pollicis longus attaches from the posterior surface of the middle of the ulna and the adjoining interosseous membrane. That is right along here. It is going to insert on the posterior base of the distal phalanx of digit number 1. Right there. And this one travels down more directly to its attachment site, right there. The extensor pollicis brevis comes from the posterior surface of the middle of the radius and the adjoining interosseous membrane right in through here. And it's going to attach at the base of the proximal phalanx of digit 1. It tucks in right next to the abductor, right in through this area. All these muscles extend the thumb to all the respective joints they attach. As well, they will help radially deviate the wrist. As we look at these tendons all contracted right here, you can see these are the two, the abductor and the brevis, and the longus is right through here. They create the anatomical stuff box, which is this little hollow right in this spot. This is a common site of overuse injuries of tendons. When we're looking at the hand, we want to make you aware of the flexor retinaculum, which crosses over and makes the cap of the carpal tunnel, and how that turns into the hypothenar eminence and the thenar eminence muscles. As well, we have the webbing of the thumb that we're going to take a spotlight here. There are two muscles over here in the hypothenar eminence. I'm just going to draw those collectively here, right here. So you can see them together. Collectively, they're going to be bringing the finger out to the side and bringing it forward, the fifth digit. So let's take a look at the adductor hallucis right here. Sorry, the adductor pollicis. Coming from here and filling in this whole area. And this is going to be obviously adducting the thumb, bringing the entirety of the thumb, metacarpal and phalanges, or at least the metacarpal, over to the rest of the fingers. And then in the thenar eminence itself, we have the opponens pollicis, the abductor pollicis brevis, and the flexor pollicis brevis. And I'm just going to draw them. They're all arising from this basic area right here, the trapezium, the tubercles of the trapezium and the scaphoid. And they're all coming up to the base of the thumb in this area. Depending upon their angle, they're going to be able, like the abductor pollicis, to bring the finger out, to bring the thumb out this way, which abduction of the thumb, because it's not sitting in the same plane as the rest of the fingers, actually brings the thumb this direction. As well, we have the opponens pollicis, which will bring the thumb to the other side of the hand. As well, we also have the flexor pollicis, which will flex like so. Well, that's all for this one, folks. Despite the silly intro, yes, I have been known to wear multiple glasses and take them off frequently, especially to see things up close. A little joke on myself there. So despite the silliness of that, we are very serious about what we do here at Integrative Bodywork for the Manual Therapist and Integration Nation Bodywork. So if this video was helpful to you, they take hours to make. And if this was helpful to you, please give us a like and a subscribe. We really do appreciate it. It just helps spread the word about what we're doing and spreading the word about informed bodywork. So please help us end mindless bodywork. Thanks for watching. Take care of yourselves. Oh, and stay tuned for the blooper reel right after this. Do keep in mind the flexor. As soon as they said pizza, my brain just went like,
It's
there we go, I'm done.
Oh, try that again.
Okay.
Look, there's some here. Work it out.
Yeah. All right. Professional composure.
Yes.
I'm smart.
If we're gonna lay me on my side, we have to do something with that dog because I cannot stop suppressing laughter. Okay, Alice? I mean, I'm like, are you mimicking me? Are you mocking me right now?
She does look like she's mocking you.
I'm like, it's crazy. All right, keep going.
But let's get one thing straight. Why can I not? What's the deal with subclavius?
Dude, I rolled over and literally eye to eye with the tongue out. I'm like, oh my God, come on. I'm doing the best I can here, dog. This was filmed in front of a live dog audience. Hard to tell, but yes, dog's alive.